Good afternoon. Good afternoon. It's about 2 minutes after the hour, so we're going to get started. I'm Erica Kelly. I'm with the National Center on Early Childhood Quality Assurance Technical Assistance Team. Thank you again for joining our webinar, Mental Health Strategies in Action, Building and Sustaining a Comprehensive Mental Health System of Care. This webinar will be recorded, and within a few weeks, it'll be posted on the National Center on Early Childhood Quality Assurance's website, along with the slides. Please use the chat to share comments and any questions you have with us today. We will not be answering live questions. Any policy questions you have, we will share with the Office of Child Care. We will also share our contact information so you can connect with us following the webinar. The Office of Child Care would like to express sincere gratitude to its partners whose expertise was essential to developing the Using the Child Care and Development Fund to promote the mental health and well-being of children, families, and the child care workforce information memorandum. Over the course of several months, the following groups and organizations have made outstanding contributions to the content in the information memorandum. The Administration for Children and Families, Office of Early Childhood Development, and Office of Child Care, the Child Care Technical Assistance Network National Centers, and the Mental Health Subject Matter Expert Work Group. The Mental Health Subject Matter Expert Work Group consists of representation from the Administration of Children and Families, Region 2, and members from the 9 national centers that you see listed on the screen. We're now going to take a look at the agenda. During today's webinar, we will extend the discussion on the recently released Office of Child Care Information Memorandum outlining recommendations to improve mental health supports using Child Care and Development Fund resources. Today's webinar will consist of opening remarks from the Office of Child Care Deputy Director Anne-Marie Toohey, an overview of new federal resources and policy guidance framework, a closer look at the new Child Care and Development Fund Information Memorandum, a look at supports for implementing mental health strategies in action. And before we close, we're excited to share with you technical assistance opportunities and additional resources to support you in these very important efforts and how you can request technical assistance. It is now my honor to introduce Anne-Marie Toohey. She serves as Deputy Director of the Office of Child Care. The Office of Child Care administers the Child Care and Development Fund, a $12.3 billion program that funds state, territory, and tribal governments to provide financial assistance to help families with low incomes afford child care for children from birth to age 13. The Child Care and Development Fund also improves the quality of child care for all children, promoting children's healthy development and learning by supporting child care licensing, quality improvement systems, and professional development for the child care workforce. Prior to joining the Office of Child Care, Anne-Marie served as the director of the Fairfax County, Virginia Office for Children, working to advance the care, education, and healthy development of children from birth to age 13. During her 23-year tenure with the county, Anne-Marie worked with dedicated colleagues to administer the county's Child Care and Development Fund program and provide CC&R services, administer Head Start grants, permit family child care homes, operate a countywide school-age child care program, provide early intervention services for babies and toddlers, provide professional development for educators, and implement a number of state pre-K and school readiness programs. Anne-Marie has led cross-systems work to strengthen and expand equitable early childhood systems, and she is also a proud former child care director. Anne-Marie?
Thank you so much, Erica. On behalf of the Office of Child Care, I'd like to welcome all of you to today's webinar. I'm very pleased to be here to continue the observance of Mental Health Awareness Month. This is the first of 2 sessions today that will extend the discussion on the recently released OCC Information Memorandum outlining recommendations to improve mental health supports using Child Care and Development Fund resources. The Workforce Supports for Promoting Mental Health and Well-Being in Out-of-School Time webinar will begin at 3 p.m. Eastern Time. The link for this webinar is in the chat. The Office of Child Care recognizes the importance of supporting access to affordable, high-quality child care for children and their families, for supporting programs that offer early childhood experiences that promote lifelong mental health and well-being of children, building the capacity of the early childhood workforce to promote children's social and emotional development, and integrating mental health supports in childcare programs to help meet needs, create awareness, and destigmatize mental health. We also recognize that in recent years, the demands on childcare staff have grown. As children's behavioral health needs have increased, so has the need for a systems approach to address mental health in early care and education. To elevate the discussion and draw attention to the many available resources to support behavioral health and well-being, the Administration for Children and Families is developing and sharing new policy guidance to support all of you, early childhood leaders working to promote the mental health and well-being of the children in your states, territories, and tribes. It is critically important for leaders to address the needs of children, families, and the early childhood workforce. The new policy and guidance were developed in collaboration with partners across the federal government and are designed to support ACF-funded early childhood programs and the partners with whom they're working to help babies, toddlers, preschoolers, and school-age children to grow, learn, and thrive. Today, we'll look specifically at the new guidance the Office of Child Care has provided on how state, territory, and tribal lead agencies administering the Child Care and Development Fund program may use funds to support the mental health of children, families, and the early childhood workforce. The Information Memorandum does not change Office of Child Care's existing interpretation of how CCDF funds can be used, but rather clarifies allowable uses for supporting mental health. I encourage you, as you hear about the comprehensive mental health systems framework, resources, and strategies in action today, to reflect on and be proud of the work you currently do. But please also consider how you might expand your efforts to integrate mental health and well-being activities throughout the full range of your CCDF-funded programs. Thank you so much for all that you do.
Thank you, Anne-Marie. We appreciate your opening remarks and taking the time to speak with us this morning about ACF's new policy guidance on how states, territories, and tribal lead agencies administering the Child Care and Development Fund program may use funds to support the mental health of children, families, and the early childhood workforce. Now let's dive into the information memorandum. We'll put a link to the information memorandum in the chat, and the QR code is on the screen. I'd now like to introduce my colleagues, Jean Van Orsdel from the National Center on Early Childhood Quality Assurance and Lisa Matter from the Child Care State Capacity Building Center's Infant Toddler Specialist Network, who will discuss supports for implementing mental health strategies in action. Jean?
Thank you so much, Erica. My name is Jean Van Orsdel, and I am a quality assurance consultant with the National Center on Early Childhood Quality Assurance. As we talk through policy guidance framework today, we want to acknowledge that many states, territories, and tribes are already doing this great work. We hope that you will be prepared to share about your work. This IM aligns with and builds on the 2022 joint Dear Colleague letter on social, emotional development, and mental health, which Ashley has dropped a link to in the chat. The recommendations in the IM are organized to span the array of services and supports that make up the comprehensive mental health system of care, and focus specifically on actions that CCDF lead agencies can take to support the needs of young children, their families, and the child care workforce. Today, we will share highlights of a few of these strategies within the overarching elements of the policy guidance framework. These elements include mental health promotion, prevention and family strengthening, and increasing access to behavioral health care. As we examine 4 of the 9 strategies included in the IM, you'll hear what the strategy is, why the strategy is important, and just a bit about what the strategy looks like in action. We also want to hear from you. Keep in mind that this is just the beginning of our conversation. At the end of the call today, we'll share some additional ways you can access resources, technical assistance, and talk to other states, territories, and tribes who are implementing successful strategies. Lisa, will you go ahead and get us started?
Thank you, Jean. My name is Lisa Matter, and as mentioned, I am an infant toddler care systems consultant with the State Capacity Building Center Infant Toddler Specialist Network, one of several child care technical assistance network national centers here to support states, tribes, territories as you make decisions about how to strengthen and align the systems of care using your child care and development funds. As Jean shared, one element of the mental health policy guidance is promotion. This element, promotion, includes strategies that promote mental health for everyone: infants, young children, their families, the early care and education workforce. As we know, mental health, just like physical health, begins in infancy and in relationships. Children's co-regulatory experiences form a foundation for their lifelong flourishing. The 4 strategies in the promotion element can support caregiving adults to engage in relationships in a way that includes and strengthens social emotional well-being, whether those caregiving adults are supported through family education, workforce training opportunities, or workforce well-being strategies. These supports can empower them to be that regulated relationship partner that's required for healthy development. Likewise, all children have mental health, and access to social emotional screening helps the system of care and the system of adults respond to their needs right from the start. Child care system leadership decisions about initiatives and strategies can advance a seamless system of care. The choices you make in serving very young children, their families, and the workforce that supports them through the implementation of the Child Care and Development Fund can contribute to strengthening that system and in turn the well-being of all. As Anne-Marie mentioned, the growing awareness that both children and caregivers are facing more stress than they can manage on their own invites all of us to consider how we might respond. The information memorandum, again, building on that dear colleague letter before it, includes a menu of choices for you to consider. The IM also suggests that you choose only a few strategies to implement, and we hope that sharing just a few today encourages you to look more closely at the wealth of choices in the information memorandum and its appendix. The promotion part of the framework includes strategies to support all caregivers and all children to grow, learn, and thrive. And you will see that you are probably already implementing some of these. Good work. And some may be a fit for your community and some may not. And while these are not the only ways to strengthen the system of care, we hope that the closer look we take at a few strategies invites you to take your next right step. So we'll begin by looking closely at 1 to 2 strategies within each area of the policy guidance framework: promotion, prevention, and access to treatment. And I'm going to pass back to Jean for us to take that close look at the first strategy described in the promotion element.
Thank you, Lisa. So let's look at strategy 1. Strategy 1 is to share information with families about children's social and emotional development, parental well-being, and the significance of early caregiving relationships. Keep in mind that it is important to provide resources that resonate with families, focus on their strengths, reduce barriers to finding services, and promote acceptance. So why is this important? Well, as you know, consumer education helps raise families' awareness about the range of resources and public programs available. The recommendations in this strategy include increasing access to information about social and emotional milestones, raising awareness, reducing stigma. By including parents, providers, and other community partners as collaborators, you will better understand their needs and be able to share materials and resources that support the mental health and well-being of your families and workforce. So what's the strategy in action? Well, one example of this is that lead agencies can consider providing information on social and emotional milestones from Learn the Signs Act Early. Learn the Signs Act Early has ambassadors, and almost every state and territory has an ambassador that can support the work of the lead agency. All their materials are free and can be co-branded with the state or territory's information, or for information for contacting a local child care resource and referral agency. One lead agency provides these materials for their CCDF grantees through their Developmental Disabilities Council. For more information, check out the link that Ashley just put in the chat. So Lisa will tell us some more about mental health promotion for the workforce. Lisa?
Thank you, Jean. Another strategy in the promote mental health of everyone policy area is to teach caregivers skills and give them information about mental health. Strategy 3 is described as build the skills and knowledge in the childcare workforce related to children's mental health and adult behavioral health through training and professional development. Why is this important? Well, caring for infants and young children in groups requires specialized skills and knowledge. A body of knowledge and know-how that includes the foundational importance of early relational health helps caregiving adults anticipate, recognize, and respond to children in ways that contribute to their well-being. The recommendations in this strategy that include a wealth of choices to consider. These include recommendations on content that might be included in professional development, such as infant and early childhood mental health concepts, compassion fatigue topics, and the effects of bias. It also recommends strategies for increasing access to those topics and supports, perhaps through scholarships, incentives, or making reflective supervision widely available. And what does this strategy look like in action? Some states, territories, and tribes have adopted sets of specialized knowledge and competencies for all early care professionals and embedded these into their professional learning opportunities. You might recognize competencies such as reflective practice, relationship-based care practices, trauma-informed or healing-centered approaches, early brain development, and resilience topics. Supporting this specialized knowledge, skills, and dispositions of the workforce that care for babies, toddlers, and young children is a great strategy that promotes the mental health of both caregivers and the children. There are some resources included in the Information Memorandum. The Child Care Technical Assistance Network includes access to training content that is widely available that builds expertise in these areas around social emotional development, resilience, and healing-centered care, including the Infant and Early Childhood Mental Health Microlearning Suite and the Infant Toddler Workforce Wellness Microlearning Suite. These are both accessible. Thank you, Ashley, for dropping those into the chat. These are both accessible to anyone who is working in a child-serving role or wants to learn more about these topics. Additionally, several states and territories have also chosen to build the capacity of their professional development system by accessing training for trainers opportunities on these similar topics, and then making additional training available in relationship-based care and trauma-responsive care in their jurisdictions. Now that we have talked about 2 of the 4 strategies in the promotion element, we would love to hear how your state, territory, or tribe is promoting mental health for all. What is happening in your context? We're going to pause for a moment and invite everyone to type something into the chat that your state, territory, or tribe is doing to promote mental health for all.
And Lisa, this is always my favorite part. I love to hear what everybody's up to and what exciting things they're doing in their programs and in their states, territories, and tribes.
And Ashley is just reminding us, you may have, when you look down at the bottom of the chat, if it's blue and it says hosts and panelists, we'll see it, but not your colleagues. And if you click on it, click on the downward arrow and choose everyone. And we thank you, Jillian, for being the first one to speak about your work in Michigan. Infant and early childhood mental health consultation, working on that statewide availability across the state. All children have mental health. All their caregivers have mental health. Mental health consultation works for everybody. Che, thank you for reporting. And I saw in the chat your role as a navigator to help people. Trainings, making free training available for whoever wants to within our state-sponsored workforce registry.
Looks like we have some folks that are steeped in the pyramid model training. And it looks like we've got some folks who are doing some emails about mental health awareness. That's exciting.
A state crisis hotline, making things accessible, easily accessible in a quick turnaround.
I like the early release day to do yoga. Oh, how fun. What a great idea. Currently partnering with Behavioral Health Department to provide services for family, students, and teaching staff. Wonderful.
I love this offer, offering school-based mental health clinics to all schools who want one. So when we are working in that promotion space, we're kind of holding things with open hands and making them accessible to whoever wants to come. Wonderful. I see we're slowing down just a little bit here. Gina just will make I always love the feelings thermometer. Part of this co-regulatory well-being for all is the idea that as the regulated adult, we set the thermostat in the room. So when we know the children's thermometers are running a little bit hot, then we need that regulatory support for ourselves so that we can connect with children.
Love it. I will start into the next element of the policy guidance framework, and you may find that some of these ideas and activities that you all are putting in the chat may actually fall into one of the other sections of the framework as well. So this is prevention and family strengthening services and supports. The following strategies are recommended in this area: evidence-based prevention approaches, parenting programs, and equitable access to infant early childhood mental health consultation. Our mental health is affected by various factors. These include our genetics, family history, early childhood experiences, and broader societal issues like violence, discrimination, or poverty. Additionally, our environment, such as where we live and the cultural messages we receive, also play a role in shaping our mental well-being. Prevention programs can support children, families, and the workforce by promoting protective factors that reduce mental health concerns. So let's take a closer look at Strategy 5. Strategy 5 is to support implementation of evidence-based prevention approaches for young children in early care and education and community-based settings. For example, having a social emotional learning curricula. So why is this important? Well, implementation of social emotional learning curricula in early childhood settings strengthens responsive and nurturing teacher-child interactions and effective classroom management. Social emotional learning approaches also support the healthy social and emotional development of the child. Some recommendations that fall under this strategy include offering grants to child care programs interested in implementing evidence-based social and emotional learning curricula, including participation in training, coaching, and fidelity monitoring activities. Prioritizing social and emotional learning in communities with children at risk for poor mental health outcomes. Partnering with state, territory, or tribal lead agencies implementing other federally funded programs, such as early intervention or maternal, infant, and early childhood home visiting. What does this strategy in action look like? Well, some states and territories already implement social and emotional learning curricula, such as conscious discipline, the incredible years, second step, or you may have a social and emotional framework, such as the pyramid model. One state has chosen to embed a social and emotional curriculum within the state's early childhood 2-year preparation program. Some tribes have chosen to integrate land-based knowledge, experience-based learning, and cultural and linguistic practices, such as talking circles, to build community and language immersion, which supports a sense of identity, development, and a sense of self. One strategy in action that a lead agency has taken is to consider implementing the pyramid model for promoting social and emotional competence for infants and young children, and the roadmap to effective intervention practices is a great resource guide for states, territories, and tribes in implementing widespread use of the pyramid model. Ashley, thank you for dropping that in the chat. So now it's time for you to share. We would like you to share if you are utilizing any activities currently in your state, territory, or tribe to increase preventive services and or to strengthen families.
And Jean, as people are thinking about that, just the comment you made right in our last pause and wonder, you might find that some of the strategies fit across promotion, treatment, intervention. And that's just what we were seeing. There were a couple comments from before that reflect this more specialized approach. Even something like, as Roxanne put in, distributing behavior has meaning wheels to the infant and toddler workforce. We could think of that as promotion. Everyone needs to understand the idea that children's behavior is communicating a need. And there might be some specific places where this is needed as an intervention, where there's maybe a bigger lack of understanding about that foundational piece. Likewise, Robin commented, looking at how to support infant toddler specialists, infant and early childhood mental health consultants, pyramid model facilitators in Colorado, with a connection of consultative roles. So within those roles, individuals might be providing promotion-based services, intervention or prevention-based services, and we'll get to intervention in a minute. I think that's my comments have given enough time for us to see what else is rolling in.
Well, and I love that folks are sharing ideas in the chat. I love that there's ideas of how, what is the background of the technical assistance specialists and how are they using this? And I love that they're sharing them back and forth, because this is how we gain from each other as well in these opportunities. So this is wonderful.
Here Shirley shares, mental health trauma informed has been implemented throughout the state of Arkansas. Here's again another place where we all know that everyone has experiences from which healing, they will benefit from healing. So understanding that when children have behavior or when adults have behavior, that it might be coming from a trauma experience helps us have a better understanding of how to promote well-being, but also might help us know when to identify this might need some more prevention. That's a great example to share. I love this. Jamie shares, I'm a tribal lead agency without a center yet. So when I construct one, I'll be able to implement these ideas. Thinking of the future as a place where everyone has well-being is lovely for us to hear.
Yeah, she says earlier she's gathering as much information as she can right now. What a great opportunity and what a great idea. State stipend for guidance strategies, offering free conscious discipline trainings, classroom coaching, promotion of pyramid, and scholarships access. That's wonderful, Shay.
And again, we see the chat slowing down a little bit, but of course, welcome you to continue to share with each other and ask questions of each other, which is such a lovely reflection of our collective well-being. We have more skills together than we do individually. So when we have the chance to learn from each other, we can grow and strengthen our work together. So again, feel free to continue to add ideas, but I'm going to go ahead and move us into the all right, let me just pause on this one. One more nice strategy. Our infant and toddler specialists are endorsed through the Washington Association for Infant Mental Health. Actually, this is a beautiful segue. And offer infant and early childhood mental health consultative services focusing on behaviors that challenge adults. So this is a really nice segue between the second policy guidance area of prevention and moving into the third policy guidance area, which is access to behavioral health. So I'll connect those together here. The final element of the policy guidance is increase access to behavioral health treatment, which is necessary even when robust efforts to promote well-being and to prevent harm are in place. When promotion for all and prevention for target populations are not enough, treatment or intervention must be accessible to some, and help may be needed to access it. And this has been a thread that's threaded throughout the comments that you all have made in the chat. We're connecting two roles together. We're having a warm line. We're making sure there's connections. So you might notice that both of the strategies in this element on the slide here reflect relationships. One starts with connect and one starts with partner, which again, you are commenting on here, reminding us that help is available and that no one can do it alone. So let's look briefly at strategy 8. And again, when the stresses of life, perhaps the behaviors that challenge adults are beyond the skills that we have access to in the moment, we might need help to navigate toward and make use of available resources. Anne-Marie mentioned this at the beginning, and we want to highlight this as well when we think very specifically about early care education. Recent data reveal high rates of financial hardship in the field of early care, as well as anxiety and depression symptoms that are persisting beyond the pandemic. Up to 44% of providers in a recent report reported experiencing difficulty paying for basic needs like food, housing, utilities, with as many as 1 in 3 experiencing hunger, including skipping meals, not having enough money to purchase food. These material hardships alone could overwhelm anyone's ability to be that regulated relationship partner that a child needs. Additionally, about 50% of providers report experiencing symptoms of anxiety or depression. And again, when a relationship is where mental health begins, when one half of the relationship needs more support, it can be difficult to support the child in care. I saw a couple of facial emoji reactions there. This is information. And why is this important? Mental health begins in infancy and in relationships. And when childcare providers, staff, and families are struggling with economic or food or housing insecurity or lack of access to services, it can negatively impact their mental health and in turn the interactions and experiences they have with children and families in their care. Sometimes and often, as we've seen in the chat, there are treatments and interventions available, but maybe not known about. So this strategy in the access to treatment element of the policy guidance is described as increase access to community health workers, family navigators, promotores, or peer support specialists to help families and childcare providers and staff address basic needs and access health and behavioral health care. So this recommendation encourages promoting things such as warm lines, that's been mentioned, online tools that can serve as a single point of entry for services, partnering with Healthy Start, piloting opportunities for community health worker to be co-located where they are accessible to the early care workforce and families alike. Community health workers, for example, we heard about in a webinar, the previous webinar, launching this information memorandum in Nevada might be able to help address those economic and social stressors and can help connect families in the workforce to needed services. Another example of this strategy in action is a state that passed legislation to establish early learning hubs. And these 16 regional hubs across that state act as that single point of entry for families to access services that are related to childcare, preschool, physical and mental health, housing, K-12 education, again, reducing sources of stress for families. So you have mentioned some of these kinds of strategies already, but we'll just invite you to share any additional strategies that have been working in your state, territory, or tribe to increase access to the treatment that's available. I love this. I'm just listening to Heather's comment and feeling supported. Here at South Shore Early Education, we have coaches who check in with employees on a regular basis. We're fortunate to have a lovely coach here in Plymouth, Mass, who meets our needs. Sometimes our need is just to be checked in on, and that gives us enough to move forward. And sometimes we might have a little bit more of a need.
Lisa, I think feeling seen and heard often is what we all need, right? And so I love that Robin talks about not only having training, but the facilitators and the coaches and working with the leadership. I think that's so important for us to remember that it's not just the professional development that changes our approach to how we approach mental health. It's having coaches, having mentors, having folks who can help us with that reflective practice, and that reflective supervision is part of that journey. And I am just so excited to see some of those other pieces around there.
Absolutely. And when the system chooses to make those things accessible, we still might not know. So the access piece comes, where these two pieces, intervention and access, come together. Kylie notes, I like the idea of having navigators, peer sports specialists available, especially for family childcare homes who are typically unable to access coaching programs in our state. And we know that's uneven across the country, access to things, particularly if you're working in a role like family childcare, where you might be working 50, 60, 70 hours a week with children. And so having that someone who can help with that navigation piece and release some of the burden of time can make access better. And thank you, Paulette, for your comment. Yes, to feeling seen and heard is important for all staff. Just what we want for babies and families is what we want for the staff, to have that experience of being seen and valued.
And I'm curious, Lisa, we've heard a couple of times about having support for family childcare providers. I wonder, are there any states, territories, or tribes on the call today that have a family childcare network that you work with, or that is happening within your state territory or tribe, because connecting with those services of a family child care network or having one in your state territory is just a wonderful way to feel supported and feel part of something bigger, right? And have networking with other family child care providers.
It's a great example, Jean. I think because sometimes when we think about treatment for mental health, we might be thinking hospitals. Just like sometimes when we hear infant and early childhood mental health, there may be a mistaken notion that that's putting the baby down on the therapist's couch. But really, it's access to the kinds of things that strengthen our relationships. And having access to a network like that is an intervention, is a treatment, so to speak, even though we wouldn't maybe say that it's a clinical treatment. So those kinds of connections across the system can really make things easier for us to get our needs met. Yeah. Well, I see the chat slowing down, Jean.
So I'm going to go forward and say to you, if there are 5 things that we would like you to take away from today's webinar, they would be these 5 key messages. First of all, the purpose of that IM is to provide actionable and allowable activities to promote the mental health of children, families, and the early childhood workforce. And there are lots of strategies in that IM, lots of different ways we can go about that. We know that many states, territories, and tribes are already doing the good work. We want you to have opportunities to think about how you can create a full mental health care network. So, and the second is that the IM includes recommendations that range in complexity and scope and is intended as a resource for short, medium, and long-term activities. And it is a menu for programs to choose from, meeting lead agencies where you are, and encouraging you to partner with other groups, agencies, partners in the early childhood system to achieve these activities. OCC cares about the mental health of children, families, and the workforce, and technical assistant teams are ready and available to assist you with prioritization and implementation. Lead agencies are encouraged to use data to increase equity and access and outcomes related to mental health. Just a reminder that some data sources are available in the appendix of the IM. This IM has numerous resources in the appendix. And so we want to make sure that you check those out. But one of the things that's there is that there are a list of data sources so that you can find out where the biggest need is for your area. The resources shared today are just a few examples of where to go if you need additional information. And so I'm going to turn this back over to Erica.
Many, many thanks to both Jean and Lisa for sharing such rich mental health strategies and action examples and elevating the examples shared by our lead agencies in the chat. Now, at the beginning of the webinar, we expressed gratitude to the Mental Health Subject Matter Expert Work Group. Notably, members of the Child Care Technical Assistance Network Cross-Center Work Group not only contributed to the content for the Office of Child Care's Information Memorandum, but also devised a plan to support it. If you're interested in learning more about the IM and mental health strategies in action, we will be offering various types of technical assistance in the coming months to meet the needs of lead agencies, you. For instance, we'll provide professional development opportunities, including conferences, institutes, and training for trainers. Other examples of support include podcasts to learn more about the mental health strategies in action and the IM, and creating learning loop opportunities such as peer-to-peer networks where you can discuss mental health initiatives, share expertise, and explore how to overcome barriers. Additionally, communities of practice will facilitate knowledge sharing and experience among lead agencies, encouraging innovation and solutions to common challenges. We're really excited to be able to continue the conversations and exchange of ideas that we have been hearing today in the chat. We are happy to share that technical assistance is immediately available to you, so we encourage you to reach out for assistance. Stay tuned for a poll shortly to explore other modalities for learning more about the IM mental health strategies in action. Did you manage to attend the ACF webinar on May 9th about enhancing mental health in early childhood? Lisa actually referenced it earlier. If you missed it, you can catch up with the replay link that we'll share in the chat. This session is really beneficial for lead agencies seeking to improve mental health support for children, featuring insights and strategies, including Nevada's notable approach. The OCC-led mental health subject matter expert work group delved into Nevada's early childhood community health worker program and our mental health strategies and action profile. The program stands out for its implementation of Strategy 8, which was just highlighted by Lisa and Jean. Some of its notable points include enhancing access to community health workers, offering comprehensive services that meet basic needs, facilitating child care programs access to these workers, assisting families and staff with addressing their basic needs, improving equitable access to community health workers, partnering with over 90 local organizations, sustaining financial support, and showing significant impact. As you develop initiatives for mental health well-being in early education settings, you may want to consider these mental health strategies in action. You can learn more about Nevada's implementation of Strategy 8 by checking out the profile, and we'll drop the link in the chat. The profile marks the beginning of a series spotlighting mental health and wellness exemplars. Stay tuned for further updates on initiatives from the work group within the Office of Child Care. On the next slide here, you'll see that we have some resources from ACF. ACF is committed to elevating mental health awareness and providing resources. Here is an example of resources. Please visit the ACF website and explore the available resources, and we will drop the link in the chat. Now, reflecting on the strategies that you heard today, which strategies are you most interested in learning more about? So as you see here on the screen, and we are going to launch a poll for you where you can select the strategies that you're interested in learning more about, and you can select more than one. So select all that apply. And you can also include the option if you're really not sure. And so thank you for launching that poll. Looks like maybe it was launched a little bit earlier, but hopefully we can relaunch that if no one was able to respond to it.
Erica, we had over half of the participants already answered, so
Oh,
we can move
okay.
on to the next poll.
Oh, fantastic. Thank you for that heads up. So we actually have another poll for you. So in the previous poll, you indicated which strategies you were interested in learning more about. So now we would like to know your preferred method for learning about these strategies. Would you like written resources, some more peer-to-peer learning, communities of practice? Again, those opportunities to have those feedback loops and sharing opportunities, webinars, individual TA, or if there's something else, please let us know. Give everyone another minute or so to complete the poll. Thank you, Tatiana. Thank you again for responding to that poll and being able to give that information to us that will definitely help to inform our future offerings. And so we will advance to the next slide, where we really just want to thank you for joining us today. We appreciate your commitment to supporting the mental health and well-being of children, families, and the early care and education workforce. Before we let you go, just a few reminders. First, the workforce supports for promoting mental health and well-being in out-of-school time will start at 3 o'clock Eastern time. So that's immediately following our webinar. The link for the webinar we will put in the chat. Second, remember to check out the website for the recording and the slides, which will be posted in a few weeks. And finally, as you leave the meeting, you'll see a pop-up requesting feedback. Your input is important and it helps us to plan for future content and events. So please take a moment to provide feedback. And if we go to the next slide, in case you missed it earlier, we have the QR code to request technical assistance, and we'll leave this page up for another moment before we officially close. Thank you again for joining, and we look forward to seeing you on the next webinar. Enjoy the rest of your day.